Okay, today is October 23rd. My name is Catherine Harris. This is Danielle Santulli. I am the examiner. She is the examinee, and she is 24 years old. Okay, so I'm just going to clean the surface, make sure it's sanitary. How are you, Danielle?
Good, how are you?
I'm good. Have any big plans for the weekend?
No, not really. Gonna relax.
Nice.
What about you?
Probably the same. Hopefully the weather is nice.
I hope so.
All right, so today we're just going to do an oral facial examination,
Okay.
which is just going to examine the structures of your face, your oral cavity, your pharynx, just to make sure there's no abnormalities. Okay? So first I'm just going to look at the symmetry of your face. Okay? All right, now we're going to look at your jaw and teeth. So can you open and close your mouth for me? Open, close, open, close. Okay, now I'm just going to feel to see if there's any popping. Sounds good. Range of motion is normal, symmetry is normal, and no TMJ noises. Okay, and now I'm just going to look inside at your teeth. Make sure you have all of your teeth. Awesome job. And can you smile? And open and close one more time. Just want to look at your occlusion. Okay. Looks good. Okay, now we're going to look at your lips. Can you pucker for me? So, pucker, all right. Okay, and now I'm just going to test the strength of your lips, okay? So I'm going to ask you to pucker one more time, but push your lips against the tongue blade, okay? So pucker for me, push hard, push hard. Okay, looks like there's a little bit of weakness there. Okay, now can you pucker for me and then smile, so the ooh, ee, ooh,
Ooh, ee, ooh, ee.
Okay, just a little bit of weakness with the pucker. But your smile looks good, symmetry looks good. Okay, now I'm going to ask you to puff up your cheeks and hold air. And just hold it for a few seconds, so like this. Okay? Nice job. I'm just going to check your strength. Strength looks good. Okay, now I'm just going to check for nasal emission, so I'm going to ask you to do that one more time and then let go, and I'm just going to check for air. Looks good. Okay. Now I'm going to look at your tongue. So can you stick out your tongue for me? And then retract it, put it back. Awesome. Range of motion is good. Okay, and can you open up your mouth in time? I'm just going to look for the color. You have good hygiene, no movement. Size is normal. Okay, can you lift your tongue up in your mouth? I'm just going to look for at your frenum. Okay, looks good. Normal sized. All right. Now I'm going to ask you to move your tongue tip to the right and to the left. Can you do that for me? And to the left? Good job. Okay, now I'm going to check the strength of your tongue. So when you put your tongue to the left, I'm going to apply some pressure and just push back against me. Good job. Okay, now the other side. Nice job. Normal strength on both sides. Okay, and now can you push your tongue tip up like you're going to touch your nose and then put it down. Nice movement. And now I want you to put your tongue to the right and to the left as fast as you can, so like this. Awesome job. You're doing great so far. Okay, and now I'm going to ask you to open your mouth up wide. I'm just going to look in the back of your throat, look at your pharynx. Color looks good. You don't have any tonsils.
Nope.
Did you get those removed?
Yep.
All right. Now I'm going to look at your hard and soft palate. So I'm going to ask you to open up one more time. Color looks good. Structure looks good. All right. And finally, I'm going to ask you to open up your mouth and say ah. Just hold it for a few seconds. I'm going to look in the back of your throat.
Ah.
Good movement there. And now I'm going to ask you to do it one more time and just say ah, ah, ah.
Ah, ah, ah.
Awesome. Everything looks great there. No nasality. All right. Thank you so much, Danielle. That's it. Okay, lastly, we're going to do the Diadochokinetic syllable rights test. And this is just going to test how fast you can say certain syllables. So the first one we're going to do is pa. Can you say pa for me?
Pa.
Awesome. We're going to say pa as fast as we can. So
Okay.
like this. Pa, 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 pa.
Okay.
You want to try it?
Pa, 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 pa.
Nice job. Okay, and you're just going to do that as fast as you can until I say stop, okay?
Okay.
Ready,
Mm-hmm.
set, go. Awesome. Nice job. Okay, now for the next one, we're going to do the sound ta.
Okay.
Now can you say ta for me?
Ta.
Okay, awesome. We're going to do the same exact thing. So as fast as you can, ta 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 ta. Do you want to try it?
Ta 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 ta.
Nice job. All right. Are you ready?
Yep.
Okay. Ready, set, go.
Ta 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 ta.
Great job. Okay, and lastly we're going to do ka. Okay? So do you want to say ka?
Ka.
All right. Now, ka, 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 ka. Same as the last two, just as fast as you can.
Okay.
Are you ready?
Yeah.
Okay, ready, set, go. Nice job. Awesome. All right. And for the very last step, we're going to combine those all together in
Okay.
patika. Now it's a little harder. Okay, so
Okay.
you want to say patika for me?
Patika.
Okay, so just as fast as you can.
Okay.
Patika, 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 patika. Okay, as
Okay.
fast as you can.
Okay.
Are you ready?
Yeah.
All right. 1, 2, 3, go.
Patika, 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 patika,
Nice
patika.
job. Awesome. All right. And that's it. Thank you so much, Danielle, and we'll discuss your results at a later time. I look
Okay.
forward to seeing you.
Yeah. Thank you.